Participants of BTX Cares Talks are fully vaccinated, wear face masks, and follow social distancing guidelines. During these segments, face masks are removed to provide clear messaging to the public. Our production crew continues to wear face masks and maintain social distancing during the filming of these productions.
Hello, Brownsville. I'm Michelle Jones, the city's epidemiologist, and I'd like to welcome you to BTX Cares Talks. And this is where we discuss those important topics that are affecting our residents. And as we all know, this is Breast Cancer Awareness Month, and we'd like to discuss breast cancer and shed some light on the disease that affects so many women. And to help us do that and to bring us the most up-to-date information, we've invited Dr. Guajardo here to discuss breast cancer on this episode of BTX Cares Talks. So welcome, Dr. Guajardo.
Thanks for having me, Michelle. Thank you for having me.
Thank you for coming. So just to begin with, some people might not know who you are or kind of what you do. So do you mind telling us a little bit about yourself?
Sure. Yeah. So my name is Dr. Gabriel Guajardo. I've been practicing here for about 15 years now. I'm a practicing obstetrician gynecologist. I'm originally from this area, or from Brownsville specifically, and left for my schooling, came back, and now I'm here to take care of the women of the Rio Grande Valley.
Oh, that is so fantastic. Thank you so much. So since this is Breast Cancer Awareness Month, some people might not be aware of what actually breast cancer is. So do you mind telling us, what is breast cancer?
Well, breast cancer is like other cancers. It involves the presence of abnormal cells that develop from a single cell and just propagate and grow and get to the point where they disrupt the normal architecture of the organ they're growing from and move on and create havoc in other parts of the body. And so breast cancer in that fashion has to do with those cells in the breast that just kind of take off. And most of them, I guess the more common of them is those cells that are found inside the duct, so ductal carcinoma.
Okay, thank you. So one thing that I also want to ask, because when we do talk about breast, we always associate that with females. But do men or do children develop breast cancer also?
Yeah. So men can develop breast cancer. It's not very common. I guess I would say that most of those men are surround the genetic predisposition. So if that develops, if a man were to develop a mass in the breast, many of them would have a gene that would predispose them to it. And so in that same fashion, when patients have a genetically defined predisposition to it, then when we do counsel them, we let them know that if you have brothers, they're not out of the woods. They also have to be screened just like their sisters would be. So.
Okay. So if, let's say, a family member was diagnosed with breast cancer, what are kind of some of the next steps? Or what's the process to even be diagnosed? We can do both of those.
Right. I guess I'll tell you that most of the time, I don't see breast cancers being diagnosed on an exam that I do. I do breast exams every time they come in for their annual visits. But I can tell you that most of the time we find them early via mammography, and mammography is still the gold standard. We have a lot of other nice modalities, but most of the time you're going to find them on a mammogram very early. And so, for example, if I have a patient that goes and gets it done, and they come back, we discuss it, they have additional screening, additional tests, additional images that need to get taken. At some point, the radiologist is going to say, hey, I need to get a look at this, right? I need to get a sample, and I need to see what's going on. And the radiologist will tell you that 85% of the biopsies that they do are going to be benign, but some of those do come back, surprisingly, abnormal. And that's where the whole process then begins. Of course, that initial, discussion is a little bit of a shock, but what we need to focus in on is getting all the players involved. And so that involves referring the patient to a surgeon that is comfortable doing that kind of surgery. So we do have breast surgeons available. that can help with that, and we also got to coordinate some care with the oncologist. And so sometimes that means a referral outside of the area, or if the patient feels comfortable, they can stay nearby.
So just for clarification, in case people aren't aware, do you mind telling us what an oncologist is?
Oh yeah, so an oncologist is a physician who specializes in the treatment of cancer.
Okay.
And within that, there are subspecialists as well that focus on specific types of cancer. And so we do have, for example, in our spectrum, in our realm, GYN oncologists. And so I guess you have oncologists, and in other perhaps larger institutions, you might have these physicians who focus on just one specific part of the body. Yeah.
So as we're going through and we're coordinating with our team, the oncologist, radiologists, and of course, you and primary care physicians, and we're going through the whole process of treating the breast cancer, what are some of the after effects that you've kind of seen when it comes to the treatment?
Well, I mean, the initial, nobody likes to get bad news, right?
Yeah.
And so that's always a difficult situation when patients come in and I have the diagnosis and I know I'm going to have to talk to them about it. So giving them the news is always, initially difficult, and it's a little bit of a shock. And so I have to do that slowly to give patients time to process. Because as we all know, when we hear something that's shocking, everything else goes blank, right? You're not going to hear most of that. And so, I take my time to go over the specifics, and I try to be as positive as I can, focusing on how early we've caught it, the size of it, if it's small, and the likelihood that we're going to be able to, that she'd be able to lead a good quality of life, acting quickly, and that we have the resources to do things. And so, again, that initial discussion is usually difficult. There's usually some crying involved. But then we move quickly, so we get them into the hands of the oncologist and the surgeons. Sometimes we refer patients away from here, like I mentioned. We're fortunate enough to be in a state that offers, high-level cancer services not too far from here, and so they have access to that pretty readily. And so once that carries on, the after effects are, after their treatment, for example, they've gone on, they've had their treatment. Now it's the recovery, right? And so the effects of recovery can be daunting. It's physically, difficult. They're going to go through some pain, and there's a significant emotional impact on all of this that takes a little bit of time. I see patients, take a while to go through it, and you see them progress and do better with time. I mean, they all do very well. I think they realize that it's not a death sentence, and they're not going to, they're going to do all right. And as they see their lives becoming, somewhat, normal, because it'll never be quite the same with everything they go through, but with some support and time, they do come around. Again, there's a lot involved in the aftermath. But like I said, what I do see is that they all come around. These patients come around. These ladies do well.
So it seems kind of what you're saying is really important. Is we're developing these networks and this team throughout the whole process, not only from the initial diagnosis, because you're probably one of the first ones who's going to be on board with the team and facilitating, but even afterwards, you might have some additional.
I've got to coordinate that initial care, and then beyond, once they're treated, they're continuing onward with their treatment. Then I've got to maintain and continue to do surveillance for their treatment. And they've had this, they've recovered, they're doing well. Now what? What impact does that have on the other side? Or is there a potential for recurrence on the same side? So All that's are things that we discuss at each of their visits. And then there's a lot of reassurance. I'm there to try to reassure them along the way. In most cases, people are okay, but they need that kind of blessing, so to speak, to say, you're okay. It's not as bad as you think. Mm-hmm.
So, since this is such a difficult situation for many women and some men that you've mentioned, what advice do you have for friends or family members when they have a loved one who's dealing with breast cancer and going through this whole journey, health journey?
Well, I say that everything takes time to be, for the patients themselves to know that it's going to be a long process and they're going to do all right. It's just going to take some time, and I'll be there along the way to take care of any issues that might arise after they, have their procedures done, or as they're recovering. If things come up, I'm there to help out and direct them and guide them in any way they can. So they know they won't be alone, and they're going to be okay. For family members, I let them know they got to be, try to be supportive, and it's hard to do. It changes everything. I mean, that's going to turn your world upside down for a while, and so it's going to impact the whole family unit. So that's one thing we discuss, or that I'd like to let them know about what's coming. And then, what do we do about? What does it mean, right? Like, what does this person having cancer mean to the rest of the family? Are there other family members involved? What is their family history? Is there a potential for a genetic process in place? Obtain family histories, more detailed, and provide the opportunity to obtain genetic testing if that's something that they want. And whether they get it or not, we still have to calculate their lifetime risk. And that's how you determine whether they're low risk, are they moderate risk, are they high risk? Do we have to do additional testing beyond mammography? That's where we can decide whether we want to do additional MRI or ultrasound or whatever, depending on their potential risk.
Since we are talking about breast cancer and screenings, how important is it for a female to get that yearly screening?
So it is important. So mammography is still considered the gold standard, and even though we have these other additional modalities and we're able to do that and we do them when we need to, we still get the bulk of our diagnosis from mammography. Again, this is beyond physical exam. Like I mentioned, most of the cases that I encounter are going to be caught early with a mammogram. And as we know, as we're continuing to improve our ability to provide, better imaging quality, their ability to see is continuing to improve, and they're catching it early. And that's the key, is to catch things early so that we can improve survival rates, improve their outcomes. Because as we catch it early, not only we're going to be able to offer different treatments that would be less invasive, perhaps, maybe not as life-altering, and would allow for an easier recovery. So even though we're seeing more, and it might seem that we're just, wow, are more people just developing cancer? The deal is we're getting better at identifying them early, and that allows us to do things to improve, like I said, our ability to treat and many times cure, and allow them to recover faster and easier with decreased long-term sequelae. Okay.
All right. So I'd like to thank you, Dr. Guajardo, for coming down and talking with us on this important topic, and also just in general for providing such wonderful care for the residents here in Brownsville. We do hope that the community found this information beneficial. And we'd also like to remind you that Valley Regional Medical Center does have breast cancer screening, and that includes the 3D mammography. And if you're concerned about the pricing, keep in mind that they do have $75 cash pricing for that. So it's within everybody's ability to go ahead and get that yearly screening. And we want to remind everyone to keep up to date on our BTX Cares Talks. And you can watch this and all of our episodes on our city's Facebook page and on our YouTube channel. And as always, remember to subscribe so you can have that information as soon as it's being released. For BTX Cares Talks, I'm Michelle Jones, the city's epidemiologist, and reminding you to stay safe and to stay sanitized.